Did you know that your skin is your body's first line of defense? But what happens when your skin starts to fight back? From the itch of eczema to the to this burn of sunburn, skin disorders are more common than you think, and I'm sure we've all experienced them from one degree to another. But don't worry, we're here to help today. Today's going to be all about protecting the body's largest organ, the skin. Whether it's dealing with acne, overcoming psoriasis, or learning how to get the best shield for your skin from the sun's harmful rays, we'll give you the 411, as well as answer your healthcare questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare questions. I'm Dr. Kamaljit Kaur, a primary care physician here in beautiful Coral Springs, Florida. Let's get to it. Today's first question comes to us from Stephen, and Stephen reaches out to us from our website, allhealthtv.com. Stephen's question is, "Hi, Dr. K. I'm a healthy, athletic, and pretty chill Black man, but I've noticed that I'm developing some spots on various parts of my body that look a little like vitiligo. I thought only women got that. I'd like to know what I can do to reverse or at least halt the spread. It's a little embarrassing." Hi, Stephen. Thank you so much for reaching out with this very important question and concern. Unfortunately, once you develop vitiligo, there's not much more that can be done to prevent it from spreading, but there's nothing to be embarrassed about. This is quite common, and there's a lot of treatments available now. I know that's easy for me to say, but it is true. Now, for those of you who may not be familiar, vitiligo is a condition of the skin that results in deep pigmented spots on the skin. Now, these spots can be in a variety of locations on the skin. They can be in a variety of size. And even though they're lighter than your baseline skin color, they can have different shades in different types of vitiligo. The exact cause of this condition is unknown, but we do have evidence that there are certain triggers that can cause it to occur in individuals. And some of these can be physical injury or illness, sunburn, emotional stress or trauma, and even pregnancy. There may also be an autoimmune, a large autoimmune component actually, and even a genetic component to consider. It can occur at any age, and like I said, on any part of the body. Also, you may be surprised to know that this can affect males and females equally. Now, in 2012, the Vitiligo Global Issues Consensus Conference developed a classification system to identify the different types of vitiligo that exist. So let's go through them. We have generalized vitiligo. This is the most common type of vitiligo, and this type can cause lesions on both sides of your body and in random areas. Then you have segmental vitiligo. This is actually the least common type of vitiligo, and it occurs only on one side of your body or in one area. And the other thing about this one is that this type usually starts in childhood or adulthood, early adulthood, and it tends to actually clear up in a year or so. Then we have mucosal vitiligo. This affects your mucous membranes, most often your mouth and or your genitals. Focal vitiligo is another type that's very rare, and this is when the spots develop in a small area and don't really spread in any certain pattern. Then we have another type called trichome vitiligo. This type involves skin of 3 different colors. So you may have 3 different shades, your original baseline shade, and then 2 lighter shades that differ from each other even. You can also sometimes see a bullseye pattern with a white or colorless center in these lesions. Now, this type is sometimes harder to treat, so the earlier it's treated, the better. And then for the last type, we have what is called universal vitiligo. This is an even more rare type, and it causes actually more than 80% of your skin to be involved and to not have your baseline pigmentation. As far as preventative methods go and treatment goes, it really depends on the type you have. As you've seen, there's several different types, and even within those, it can vary as far as what lesions you have, how many you have, where on your body they actually are. And treatment is really going to be tailored to your specific individual case. Potential treatments include, but are not limited to, oral steroids, targeted UVB phototherapy or laser therapy, or even systemic immunosuppressants, depending on if you have an extensive case. Stephen, I suggest checking in with your PCP or your dermatologist for evaluation of your lesions to get a really personalized plan and get the best treatment for you. All right, let's move on to our next question. This comes to us from Karen, and she reaches out from YouTube. Karen asks, "Hi, Dr. Kaur. I'm in my first year of college and it's been pretty stressful. So the classes are harder than they were in high school, which I understand. And there's drama with my roommates. Anyways, I've developed an annoying rash and I can't tell if it's psoriasis or eczema. How can you tell the difference and how can they be treated?" Hi, Karen. That's a great question. And yes, I appreciate that college is a very stressful time. And if you have any other psychosocial stressors that you're dealing with, that can make it even worse. And just like you're alluding to, when you are under stress, whether it's mental stress or body physiological stress, that can induce certain things in the body to happen and certain diseases to come about, like eczema and or psoriasis. So both of them do have very similar symptoms, but they occur in different mechanisms and can affect different parts of the body. Let's start with psoriasis. We used to think that psoriasis is a disease of just overactive skin cells, but now we know so much more. Not everything, but so much more. And we know that it involves a much more complex set of mechanisms and mostly an immune response that may be over exaggerated and it's disordered. Whereas with eczema, the theory of whether or not it's mostly autoimmune is still up for debate, but we do know that there are environmental triggers to eczema and external triggers that maybe you don't have control over. Now, to the naked eye, it can be difficult to determine which one we're actually looking at. So generally, this does require a more detailed evaluation with a dermatologist. And sometimes they can even look at it with what's called a dermoscope, which is a medical grade microscope, basically that looks at the lesion and allows the dermatologist or the clinician to really see what's going on almost underneath the surface. Now, some of the symptoms can be slightly differentiated. So even though you can't see it, maybe you can feel it. For instance, the lesions with eczema are very, very itchy. They're usually more itchy than psoriasis is. And then if you have any component of a burning sensation or discomfort or pain or even joint pain, then our suspicions are going to lie a little bit more towards psoriasis. Psoriasis, as I mentioned, is also associated with joint pain. And psoriasis comes in different varieties, as does eczema, and the distribution of involvement of the skin can also be different. Now, when it comes to appearance, eczema lesions and eczema rashes are generally more mild looking than psoriasis is. They're usually thinner and have less what we call scaling or coming off of the skin. Psoriasis generally presents in thicker plaques, and sometimes you can even have cracked skin with psoriasis, and the scaling is usually more prominent with it. As far as treatments go, this can also vary. For plaque psoriasis, there's really no cure, but it can be treated so you can comfortably take care of the lesions and continue to live a comfortable life as if you didn't have it. There's also a variety of medications. For eczema, not only are medications important, but remember I was talking about those potential external factors that may provoke an eczema lesion to appear? Well, some of those external factors include the sun's rays. So if you're exposing your skin in prolonged periods to the sun, also dry skin. So if you're not applying enough moisture to the skin, it actually cracks that skin barrier and promotes the formation of eczema and a little bit of inflammation as well. So with eczema, not only medications, but you also want to keep it well hydrated and you want to make sure that you're wearing sunscreen. Really, with all skin conditions, you want to make sure that you're wearing sunscreen. Either way, we do know that stress is a contributing factor for both psoriasis and for eczema. So I also encourage you to implement some stress reduction and relaxation techniques, not just for your skin, but for your overall health as well. I wish you the best in the rest of your classes and hope you'll do well. All right, let's get to our next question. And this one comes from the YouTube. And this comes to us from Kevin. Kevin asks, "Hello, Dr. Kaur. This bump appeared on my pointer finger a few months back. I thought it was a blister at first, so I didn't pay much attention to it, but now I've developed a few smaller ones on other fingers, which makes me think they might be warts. What causes them and how do I get rid of them?" Hi, Kevin. Thank you for sending in your question. And I do appreciate that this must be frustrating. Let me begin by saying that skin warts are usually caused by the HPV family of viruses. And an individual can contract HPV through different mechanisms, but most commonly through direct skin to skin contact with somebody who is already infected with HPV. You'll be surprised to know, however, that sometimes no treatment is needed at all because these lesions tend to go away on their own. But there are times when we do recommend treatment or when our patient wants treatment. And that usually happens if the warts or the lesions are in places where they're uncomfortable. So if they're between your fingers or honestly anywhere in the finger, because we use our hands for a lot of different activities, right? If the warts are in a place where they're causing you discomfort or pain, that's a reason to seek treatment for them. If you're somebody who has an immunosuppressive condition, so if you're somebody who's undergoing chemotherapy treatments or cancer, or even somebody who's on long-term steroids for another condition, is considered to be immunosuppressive and may want to get treatment for those warts as well. So there are different treatments, and we commonly do begin the variety of treatments first with salicylic acid and by burning them off, so to say, with cryotherapy using liquid nitrogen. Kind of cool, but that is absolutely a valid treatment that does work. There are a few other treatments as well, but it really depends on a variety of factors, what exactly the lesion is, how big is it, where is it, and really what's going to be the best treatment for it because they do tend to come back as well. I hope you'll see your dermatologist and get the treatment that'll help you the most. In case you missed it the first time, guys, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, our next question comes to us from April, and she reaches out to us through our website, allhealthtv.com, which if you haven't gone onto the website or looked through it, I highly recommend that you do. It's chock full of a lot of great information. Let's get to April's question. Hi, Doc. I have a question about stretch marks. My mother has them, and so does my sister. Of course, they've both got kids, so I guess it makes sense. Are stretch marks inevitable with pregnancy, or is there a way to prevent them? Hi, April. That's a great question. And when it comes to skin-related conditions, this is a very common question, both with men and with women, because we all get stretch marks, or we are all prone to stretch marks, I should say. So while we associate stretch marks with just that, stretching of the skin for whatever reason, we actually don't know exactly how they form, but we do know that there's more involved than just stretching of that skin. Since we don't see the same type of stretch mark in every pregnant woman, we do know that there are other factors at play here. So genetics might play a role, and of course, hormones play a role as well. Then there's also the individuality of you and your skin. So even though your mother and your sister had stretch marks, it's not a guarantee or 100% that you'll ever have them as well, because it depends on individual factors in your skin and individual mechanisms that take place in your skin. So all of that being said, not everybody is going to get them, but it is still possible. And of course, when it comes to pregnancy, hormones have their hand in a lot of different mechanisms in our body, and this is certainly one of them as well. The other thing that I want to point out that's very important for everybody to know is that when it comes to stretch marks, even though they're not debilitating or really affecting our health per se, I know that they can be quite annoying. And because of that, I know that there's many men and women who seek treatment for them. So what is the treatment for them? While there's really no one treatment that's going to effectively completely erase the stretch marks, no matter where they are on your body, I know there's a lot of lotions and creams and other things over the counter that have the claim that they can. So I just want our viewers to be a little bit cautious with that. Take it with a grain of salt and just have the appropriate expectations. I know it's frustrating not to have definitive answers when it comes to something like this, but I do understand the frustration and encourage you to talk to your doctor about what might be the best treatment for you. If you do decide to pursue medical treatments for stretch marks, there are a couple that are gaining traction and do have some benefit. Some of these are lasers. You have fractional lasers and what we call pulsed lasers as well. Microneedling, I know a lot of us have heard of microneedling. That's something that has been used for stretch marks as well. And then there's also topical retinoids. So lotions and creams like Retin-A, that's very common. But the thing is, if you're pregnant, you want to avoid those. So again, always talk to your doctor and see what's best for you. All right, friends, it looks like we have another question from our website, allhealthtv.com, and this one comes to us from Susan. Susan asks, "Hi, Dr. Kaur. I have a little dilemma here. I don't know if I had chicken pox as a child, and there's nobody left that I can ask. If I get the shingles shot and never had chicken pox, would I be getting something I don't need? What should I do?" Hi, Susan. Great question. Before I answer it, let's check out this video from our friends at the Mayo Clinic.
The burning pain of shingles makes you feel like your skin is on fire.
It's caused by the same virus that causes chickenpox.
Dr. Vandana Bidet says after you've had the chickenpox, the virus can live in your nervous system for years. No one's sure why it reappears, but the thought is if your immune system weakens because of illness or the aging process, the virus can reactivate and travel along your nerves to your skin, causing severe pain and blisters. The pain can happen days before the rash erupts. There's no cure, but medication may lessen symptoms and shorten suffering. A vaccine recommended for people age 60 and over can help prevent shingles.
We know that it will significantly decrease the risk of getting shingles in these people, and it will also decrease the risk of something called post-herpetic neuralgia, which is this very painful kind of phantom pain almost that's in the region where shingles was, but is after it's already healed.
For the Mayo Clinic News Network, I'm Vivian Williams.
So that was a great video explaining shingles and what the potential adverse effects of having the infection and if it's not treated are. Essentially, just like they mentioned in the video, shingles is a reactivation of that chickenpox virus that most of us had when we were younger. Now, it is possible though, and this is why we recommend that everybody get vaccinated, that you may have had, or an individual may have had chickenpox as a child, but didn't show symptoms. So you didn't get that classic pimply rash that's very, very itchy and painful everywhere. And even though it's not common, it can happen. So if that happens, then that individual may think, hey, I never had the chickenpox, so why do I need the chickenpox vaccine? But they would be a misunderstanding of the situation, and they may be exposing themselves to shingles, which can be quite detrimental and quite impactful, negatively impactful to your overall health. Now, when it comes to the vaccine, we do also recommend it because we've seen that even individuals who've had chickenpox in childhood and have that natural immunity, as they get closer to age 50 and certainly over age 55, that immunity actually declines and continues to decline with age, which is why we are a little bit urgent on the topic of the shingles vaccine, not only to prevent the actual rash, which can be quite painful and impactful to your daily routine. You may have to stay home for a few days. You may not be able to do the things that you like to do while you have the infection, but also because once that infection clears, just as they were mentioning in the video, you may contract a condition called post-herpetic neuralgia. Now, this is basically because the virus has done so much damage to the nerve that it infected, that nerve now has some prolonged inflammation, which causes prolonged pain. This condition can last for a couple days, couple weeks, and I've even seen it last lifetime for some people. So that being said, those are very, very important reasons why we recommend, highly recommend the shingles vaccine. All right, let's get to our next question. And this one comes to us from Jeanette. And Jeanette asks, Dr. Kaur, what is the difference between a cold sore and canker sore, and what are the best ways to treat them? Oh, this is a great question because I know we commonly hear these words, canker sore, cold sore, and we think, it's all in the mouth, treatment is the same, and, we go about it that way. But that's very incorrect. While these conditions are both very painful or can be painful and certainly annoying, they're quite different. So let's go through them. Cold sore is essentially a very painful, pus-filled vesicle, pimple, that can appear anywhere in the mouth. Most often we see it on the lips or right inside the lips. And this is caused by the herpes simplex virus majority of the time. This can also be very contagious. Then you have canker sores. And while canker sores are painful and they're an inflammatory response, they are not contagious. Canker sores usually happen in sites of the mouth or lips where there has been some degree of trauma, or even stress can bring on canker sores as well. The treatments do vary for both of them. So for cold sores, we generally use antiviral medications, and those can be either oral tablets that you take or lotions or ointments that you apply directly to the cold sore itself. And they can take up to 2 weeks to heal. Then you have canker sores. Since these are not contagious and there's not an infectious component to these, there's no antiviral or antibiotic needed for routine canker sores. But because they are quite painful, then we do want to make whoever has them comfortable. Obviously, we want to help you treat them. Your body will generally take care of the canker sore itself as long as you are healthy and you're not drinking a lot of things that will be abrasive to it. So citrus juices, alcohol, caffeine. Most of the time, living a healthy lifestyle will encourage your body to take care of that canker sore on its own. But we as physicians are happy to help you through that by providing topical analgesics. So like a lidocaine cream, ointment, or mouthwash a lot of the times as well can be helpful for both of them. And always, anytime you have a sore or something going on in the mouth, you always want to show it to your doctor because you want to make sure you have the right diagnosis and you're getting the right treatment for it. All right, in case you guys missed it the first time around, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've got another question from our website, allhealthtv.com, and this question comes to us from Delilah. Delilah asks, Doctor, my teenage son has unfortunately developed a pretty severe case of acne. It's definitely had an adverse effect on how he feels about himself, so he sits in his bedroom all day and plays video games. Can a dermatologist really do anything? Hi, Delilah. Thank you for reaching out. And I know as a concerned mother, this definitely is something that's on your mind. And I can understand that not only from the perspective of a loved one, but from a personal perspective too. As a teenager, I really took my skin for granted, and it was great. But as soon as I hit the stress of college and the stress of medical school, it was like a light bulb went off and it was acne all over. And I spent years dealing with it because acne, especially when it's severe, can be very difficult to treat. And you usually need different modalities for it. It's not surprising that at a certain age, individuals will start to experience stress, and then that can definitely promote the formation of acne. Now, mild cases of acne can be treated with just over-the-counter topical medications, but more moderate and especially severe cases of acne, when you have acne that's either painful or cystic large lesions, or even lesions that are on your shoulders or other parts of your body, those cases are more difficult to treat and generally require the oversight and evaluation of a dermatologist. The treatment for acne isn't usually just one cream or one lotion or one tablet. It's usually multifaceted. So you want to make sure that the daily hygiene of the skin is good, that you're not exposing it to too many harsh or abrasive chemicals. Sometimes you might even need an oral anti-acne medication that your dermatologist will talk to you about. And then sometimes you may even need treatments like lasers or chemical peels or a whole bunch of other stuff. But no matter what it is definitely something that I personally would suggest getting a dermatologist involved. I've been dealing with it myself for the past 20 years, and it's taken me that long to really learn my skin and know what I can do to prevent it from breaking out and from being unhealthy. So I encourage you to suggest that to your son, and maybe you guys can go together and he can have the treatment that he really deserves. The thing about acne that I also want to say is even though it's a medical condition, it is something that is very psychologically impactful because we want to feel our best, we want to look our best. And with acne, that generally really impedes it with the lesions that are on your face and the pain that comes with them sometimes too. So it's always important to talk to a doctor. And I do encourage, even if kids are younger in their teenage years getting acne, it's something important to get diagnosed and to treat it appropriately so can it prevent future breakouts as well. All right, folks. Well, that's all the time we have for today. The questions were great. Thank you for sending them in. Keep on sending them in, and I'll see you here next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.